Doctors of Reddit, what was the worst thing you have seen for a patient that another doctor overlooked? Neurologist sent patient to our Ed without informing her that imaging showed a glioblastoma, assuring her impending death. He did not overlook the disease. He overlooked the communication. He just sent her over for you to do the dirty work of telling her she was dying. Jeesh. That is the shittiest thing one doctor can do to the next. MD here. Recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure. Bleeding a little. 'Tis but a scratch. Your whole leg's gone. In residency I saw a cardiologist miss a STEMI heart attack. By the time the patient came to us, some of the muscles supporting one of his heart valves had completely died, and he was in cardiogenic shock. Basically his heart function was so bad that it was not circulating the blood in his body enough to support life. It was awful. Happily he made it through though. It was obvious on ECG. It was like textbook tombstones on the ECG. No idea how it was missed. Young student from, I think, Pakistan. He was complaining about his neck feeling stiff. He went to a doctor some days before, and he was told he was having joint pains that would pass with some common anti-inflammatory drugs. When I visited him, I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness, and not painful, not a good sign. Sent him right away to have a chest x-ray that showed a huge mediastinical mass, suggestive of lymphoma. Sadly I don't know what happened to him. Not as bad as that, but I had neck and shoulder pain and stiffness for about 5 years, with docs telling me it was just soreness, text neck, etc. and prescribing NSAIDs and muscle relaxers. Finally a new doc said to see a rheumatologist. Diagnosed with ankylosing spondylitis. Doc said it is often misdiagnosed or left undiagnosed. Frustrated me for so long because I knew something was not right. What were the things you felt not right, if you do not mind? Persistent tightness and soreness. Like there are constant balled up fists in my neck and upper shoulders. It has its better and worse days, but never fully goes away. Stretching and massaging helps. I also have much worse range of motion, so I try to keep on stretching to keep as loose as possible. Always wished there would be some magic bullet to make it go away, but could not find one. It is at least manageable now. I'm hoping that medication keeps it from worsening, both in terms of pain spreading and hunching, loss of range of motion further. Once when I was a medical student on surgery rotation in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. So as part of our trauma workup, given that he could not give a great story and we could not be sure what happened, we CT scanned his abdomen and saw his common bile duct was like 3 times normal size. Could drive a truck through it. About that time. Next set of vitals, his temp was 103F. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. I like how you use the word bonked. I hope it was the same language in his medical record. What is your diagnosis? Doctor. Doctor takes his glasses off. Pinches the bridge of his nose. The patient has hella head bonkage. Bonked in the UK is yet another word for had sex with. It is very old fashioned and not offensive, so we don't bother with it much. But bonkage could change the game. I found an obvious huge rectal cancer on a patient who was previously told over and over again that she had hemorrhoids. My sister-in-law was fobbed off with the exact same thing. Young female, severe chronic abdominal pain. Finally referred for a scan, which was cancelled because she was low risk. She was again in a lot of pain, so my brother insisted she be checked again, this time by a new physician who decided to do a rectal check. Diagnosed with colon cancer there and immediately referred for a scan, then to the best specialist in the area. Chemo. Removal of most her bowels, narrowly avoided a bag and a lifetime of adjustments, but thankfully in remission now. 2 years of being diagnosed with piles instead. My husband has been going through this for years. Now this year he has dropped 80 pounds and is extremely sick. He is waiting to see a couple other doctors this week, but his other ones are being extremely fragile with him all of a sudden. That's terrible. Wishing for the best for you and your husband. Probably the worst story one can hear. My wife found a lump under her breast that was really concerning. It took her about 2 months to get a proper appointment to have it looked at. Doc diagnosed it as cystic fibroadenoma. She drained the lump and it was fine. Grew back a week later and was bigger. Finally, after being in pain for weeks on end, the doctor said this is clearly not working, so we will do surgery and remove it. Upon going in for the checkup, thinking they'd take a look at the scar and healing, it turns out that she had stage 2A triple negative breast cancer. The surgeon was absolutely flawed. The most upsetting thing was that while her main surgeon Gino, who was fantastic, was on holiday, another male doctor told her any surgery would be merely cosmetic and it clearly didn't bother her because he could touch the lump. I almost laid that doctor out in the office. When she got the diagnosis, he apologized to both of us for being in a hole. Unfortunately, this story didn't end well. Despite doing 8 months of therapy, chemo and radio, her cancer returned 7 months later and ultimately led to her death after it spread to her brain and spinal fluid. So many people told me our breast cancer. That's one of the easy ones. My insert relative nobody ducking cares about here had it. She switched gynaes twice because they wouldn't take it seriously. It's been 6 months now and not a day goes by where I wish I could have taken her cancer away. She was ducking 27 years old. I'm so sorry for your loss. It is unfair and horrible, and I hope you heal in time. My wife also found a lump and the first doctor did not even seem concerned. The second realized it was cancer, turned out to be stage 3 triple negative breast cancer. My condolences to you. It really is a wretched illness. I have several tattoos dedicated to her and I have found my path in healing. It doesn't get easier, just different, and I try to be proud of myself for still being here 6 months on. Duct cancer. I am sorry. I should have been clearer. My wife is still undergoing treatment, but definitely duct cancer. Not a doctor but the patient. When I was born, I was my dad's 3rd child too from a previous marriage. He knew something was wrong with me because of the way I was breathing very rapid, short breaths. When I was 3 months old, they noticed there really was not a change. The first hospital he and my mom took me to, they said that there was nothing to worry about and babies just breathe like that. He was 100% certain they were wrong. They took me to a second hospital and they said there is definitely something wrong, but they did not have the technology to help. 1986. They recommended us to a third hospital, which was a couple hours away. Finally, the third hospital took me right in and performed surgery that day. Turns out I had 5 holes in my heart. They tried to go through my rib cage, but it did not work. They had to crack my sternum and go directly through my chest. They took my heart out of my body and patched the holes. I'm doing wonderfully medically today and am forever in their debt, not financially. Thank you, Ronald McDonald House. I was a few days old and my parents' first and only child. My mum saw me turning bright red and blue around the lips when I cried. Mum demanded the pediatrician, to which a nurse told her, "Oh Mrs. Sailway Orion, this is your first child and you wouldn't know." She replied, "I teach child development at the tertiary level and this is not normal." Got the pediatrician in, and boom, I have tetralogy of Fallot. I do not know what that last part means, but those symptoms are pretty clear. Something is wrong. Glad you are good. Tetralogy of Fallot is a congenital, meaning you are born with it. Heart defect, where the wall separating the left and right sides of the chambers of your heart has a hole in it and or is not completely formed. Jimmy Kimmel's son was born with it, and he talked about how scary it was for him and his family. It is one of the things that APGAR tests are designed to catch in newborns immediately after birth. I work in EMS. We got a call for a female with leg pain. When we arrive on scene, this woman's leg is 3 times the size of her other one, blue and purple, and she has no pulse in her foot. She fell on ice a few days prior and the urgent care didn't do any x-rays. Told her she had a sprain and gave her a walking boot. In reality, Her tibia and fibula were both so badly fractured they were cutting the blood vessels and muscle tissue. She lost her foot. Holy shit. Losing a foot is a serious consequence to something so normal. I don't understand why they wouldn't do an x-ray. Of all these stories, this one is the strangest to me. Why would you give someone a moon boot, not x-ray? Are all these stories sheer incompetence, or are hospitals in America for profit want to do things deliberately to save money? I honestly don't know why they did what they did, but it was serious malpractice. I never ended up having to testify, but we were all deposed, and our reports were used. The urgent care is no longer operating under the same name. It was bought by a hospital, and the poor lady seemed very uninformed about her own health. I think they might have been especially negligent, since she was already in poor health, and had a history of making appointments when there wasn't anything wrong. This time, there was, of course, and the consequences were severe. The case was settled a few years ago, and I'm allowed to speak of it in general terms but no specifics. I work as a scribe in an urgent care, and one thing the providers always stress to us, that you never want to miss something important. Even if the patient has a wonky history, you treat each visit on its own merits. One that comes to mind is when I was a resident. The ED doctor wanted to admit a mild septic patient with a UT. I review her labs, and knowing that she is a diabetic, it was obvious florid DKA, diabetic ketoacidosis. That kind of admission typically goes straight to the ICU to get insulin via a drip and aggressive fourth fluid rehydration. She was just in the ED hallway with no medications at all, looking like crap. Oh my god bless you. As a parent of a type 1, the hospital terrifies me. I've seen studies that say there are worse outcomes due to lack of knowledge of care. I will call the endo every hour when he is sick and spoon feed crushed ice every 3 minutes for hours to keep us home. DKA kills kids, and definitely kills young adults once they leave the care of their parents. Bless your catch, and please tell this story over and over. As a T1D, I have learned to fend for myself, living with this for almost 30 years. I'm my own advocate. This doc knows what is going on, but it seems most docs only have basic knowledge of diabetes, and it is typically more T2D. So advocate hard for your kiddo if when they go to the hospital, although no need to call the doc feed ice every few minutes when they are sick. Get some ketone strips and check sugar more often than normal. It is so true. I took someone to the ER with DKA, and they waited 10 hours before they thought maybe she should get admitted straight to the ICU. Severe acidemia. They were not sure if she would make it through the night. Thankfully, treatment worked, but it was so frustrating to be sitting there going, I'm not a doctor, but even my basic knowledge of biology is enough to know that severe acidosis leads to organ failure fast, and have the admitting physician say, well, she might recover. We will keep her on saline for a little while longer to see if she really needs to stay or not. ICU doctors were not at all happy with the ER docs when I relayed the story to them, since she was unconscious by the time they got her to the ICU. Oh, and just to be clear, she was in the early stages of DKA when she went in, because she knew something was wrong, and progressively got worse until they decided it would not correct itself. The struggle to even get admitted was bad enough that after the third time the PA and the doc that was treating her requested an admit and were denied. They flat out told me she is not going home tonight. We will not let it happen. Regardless of what the admitting says, sending her home would be a death sentence. AIDS. As in, the patient had no working white cells whatsoever. It all started with what appeared to be a fungal infection in the chest, but after many pulses with itraconazole the plaque was still present and growing. So the physician called me to check the patient, and the chest plaque was indeed very suggestive for a fungal infection. The direct examination even confirmed the existence of the fungus, but the treatments were doing nothing. So I rechecked the file, and lo and behold, the leukocytes count was quite low. A quick HIV test later, and the patient was diagnosed with AIDS on top of its body fungus. To the credit of the physician that called me, the patient lead on the clinical exam as he marked he had no active sex life. But when confronted with the evidence, he spilled the beans. Turns out he was a regular with the local hookers, but also quite active in online dating. Public health wasn't happy, to say the least. Oh, I have got a good one, albeit sad. I was working nights and a patient came in for a nail bed repair under general anesthesia. It was a slow night. As they are anesthetizing him, he aspirates, so we do a chest x-ray to see if he has got any sped blood in his lungs. What we did not know is that prior to this emergency surgery, he had been going to his GP for over 6 months complaining about chest tightness. They would put him on various different asthma medications, but none had any effect on him. The x-ray showed a massive dark mass in his left lung. We kept him asleep and transferred him to ICU. His wife and 3-year-old daughter were waiting for him on the ward. We had to tell them where he would gone, why he would gone there, and what was going to happen. He died from lung cancer within a month. My foot doctor told me a story. He had a patient who had foot pain, so they took a look and found that the bone was infected. They sent a biopsy in, and it came back as lung cancer. Turns out, the patient was being treated by PCP for bronchitis for 2 years. This was an older woman. If it hadn't he spread to that old injury in her foot and seen the podiatrist, who knows how long it would have taken to get diagnosed. He said he doesn't know what happened after that because he immediately sent her to the appropriate doctors. Just pisses me off so bad. 20 odd years ago now, my gran went to the doctor for shoulder pain and died in hospital. Turns out she had cancer, but they could not even tell where it had started because it had metastasized to a bunch of other places by the time they found it. We assume lung cancer because she was a heavy smoker, but in the last 3 years, I have also lost smokers in my family to ear cancer, stomach cancer, gallbladder cancer, and my uncle has just been diagnosed with bladder cancer. Please do not smoke, kids. My dad was a smoker and also worked for 10 or so years in a brake pad plant where he refused to wear protective breathing masks. He was always scrawny, and we have a genetic disorder that causes tumors on nerve endings. So the occasional tumor is nothing to get excited about. I was taught from a really young age what to look for in one you should be worried about. He got a weird tumor on his arm, kept insisting it was one, like we get normally. Eventually, mom badgered him into going to the doctor. It may have started as lung cancer, but it ended as cancer of the everything. The doctor said they would never seen lung cancer metastasize to the outside of a person's arm. I have known a bunch of other working class men from where I grew up die in similar fashions. It appears you can smoke and work white collar, or you can be blue collar and skip smoking. But just to be safe, like, skip smoking. Thank you for watching. We hope you enjoyed this video. Please subscribe for more videos.